Hello, everyone. My name is Tiana Brown, and welcome to today's webinar, ARPA Stabilization Grants Briefing. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. All participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the control pane of the control panel. You may send in your questions at any time, and we will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. I would now like to turn it over to Kathy Glazer, VECF President.
Thank you, Tiana, and good afternoon, everyone, and welcome to today's webinar regarding the Child Care Stabilization Grants through the American Rescue Plan Act. On the agenda today, you'll see that we will learn more about the upcoming application process for accessing these federal funds to stabilize child care programs. Jenna Conway and her colleague Rebecca Ulrich from the Virginia Department of Education will give an overview of the grant program, outline eligibility, the formula that was developed to determine grant amounts, conditions for receipt of funding and allowable expenses, and then we'll give a sneak peek at the application platform. And lastly, today we'll hear about ways that Virginia is working to provide supports for current staffing shortages in child care. We're going to go ahead and turn to Jenna and ask her to get started. I'll make a note that the First Lady plans to join and provide some comments. She is traveling and en route and still trying to work us in today. So Jenna, I'll interrupt you when I see the First Lady joining, and we'll hear her comments before you continue. But with that, I'm pleased to turn it to Jenna Conway.
Excellent. Thank you, Kathy. Thank you, everyone, for joining us this afternoon. I believe we are at nearly 1,000 attendees, we are so appreciative. We know everybody is incredibly busy. As we'll talk quite a bit today, we know you're facing enormous challenges, while also, if there's a bright spot, getting ready for Halloween. I had the opportunity to go to my son's preschool this morning for a fall festival and costume parade, and I really appreciate everybody making time this morning in between all of the million other things you are doing. I'm Jenna Conway. I'm our Deputy Superintendent of Early Childhood Care and Education for the Virginia Department of Education, and I'm glad to be with you all this afternoon to talk through our exciting new grant program for child care providers here in Virginia. The child care sector has been so profoundly impacted by the COVID-19 pandemic. We know you are facing higher operating costs, staffing shortages, and increasing demand for care. We know you've been going through such a difficult time, and we are very pleased to be able to talk to you today about our grant program. We are also incredibly grateful for, look at that, I will pause before I get too into it. It looks like we have a very special guest about to join us. I see David Carey, who is our Assistant Secretary of Early Childhood Care and Education and Chief of Staff to the First Lady, coming in here. So let me pause and see if we are ready to hear from the illustrious First Lady of the Commonwealth of Virginia. Or maybe not quite yet.
Looks like
if we could take, having some technical issues.
There she is. Awesome. Welcome, First Lady. Uh-oh, it's still muted.
How about now?
Perfect.
Yes.
Awesome. Thank you all. I'm sorry, we just flew in. We're here in Abingdon. So happy to see you all out there today, and thank you so much for letting me still get a chance to talk with you all despite being on the road. But well, we're so happy to be here with you all, and we thank our friends at the VECF for hosting us today and for the great experts in our department of Education who've been working for months to ensure a secure and fair process for distributing these vital funds. You know, since 2018, I've been traveling over 11,000 miles. Whew, I think I look like it too these days, and had the great pleasure of meeting many of you in your communities. In fact, like I said, I'm on the road again now, right here out in Abingdon. And on behalf of a grateful Commonwealth, the governor and I thank you from the bottoms of our hearts. You have truly been heroes on the front line throughout this pandemic, and thousands of parents and employers are in a much better place today because of all of you. Not to mention the countless children whose lives will be changed for the better because of your dedication, consistent loving care, and support throughout this difficult time. Although we know this falls short of solving all the problems faced by our early educators here in Virginia, this $488 million stabilization grant program is unprecedented and a great start. After each visit with you, I carefully carry your messages back to the lawmakers in Richmond, your powerful and moving stories, and they have listened. Together, we put our money where our hearts are by doubling the investments in our little learners. These record investments mean that 25,000 3- and 4-year-olds who need it the most now have quality care and education. We also work to expand child care subsidy eligibility to include more working parents than ever before, so that since March, when we began, an unbelievable 25,500 children now have high quality opportunities with great providers like you all. And now President Biden is working with members of Congress to pass a game-changing long-term investment in our early childhood system. So now we have more advocates working at the local, state, and federal level to support these critical years in a child's development. Working together, we are a powerful force for good. But we still need your help. Please, your voice is important now more than ever. We encourage all of you to invite your state legislators to your classrooms. Show them the amazing work you do day after day. Contact your U.S. House and state members, encourage them to pass this infrastructure package, because we cannot rest until every child has good nutrition, adequate housing, medical care, excellent education, clean air and water, laughter of loving families, and an economically thriving, supportive community. Finally, the governor and I are so grateful to you for protecting yourselves and the children and families you love by getting fully vaccinated, as well as helping us to win this battle against this awful disease. While we're excited to see that Pfizer vaccines moving close to approval for children as young as 5, the majority of your little learners will not be eligible yet. And that makes vaccinations especially important for all of us to build a wall of protection for them. So if you haven't had a chance yet, please visit vaccinate.virginia.gov to learn more and locate a free vaccine near you, or talk to your personal physician. Again, the governor and I are extremely grateful for all that you do. As I always say, you truly hold the future of Virginia in your hands, and I look forward to meeting many more of you again soon. So take care, everyone, and thank you so very much.
Thank you so
Wonderful.
much for dashing off the tarmac and rushing to a site so you can join us today, and still looking great. Thank you for all you do. We appreciate your presence here today.
Miss it for the world. You know, you all, I would fly across the world to be with you. So thank you all so much.
Thank you so much. All right,
Wonderful.
Jenna, we'll turn it back to you.
Thank you, Kathy, and thank you, First Lady. I couldn't say it better myself. So we'll jump right in. So today we're going to give you an overview of the Child Care Stabilization Grant Program that the First Lady just described. We'll talk about who's eligible for funding, how funding levels are determined, and the requirements. And then we'll actually give you a sneak peek into the application portal, which is set to go live on Monday, November 1st. We'll close out the session with some additional details on what we are doing to help provide, to address some of the staffing shortages and the staffing crisis that you're facing. We'll pause, and I think we've also got the chat function if there are key questions, so go ahead and type those in if you can. We are also recording today's session. I see we are already at 1,001 participants, and so If you hear from colleagues and friends and associates who can't get in, please rest assured we will record this and distribute to the broader licensing distribution list next week, or even as soon as tomorrow. So with that, let's get into details about the Stabilization Grant Program. Next slide, please. So the purpose of the Child Care Stabilization Grant, and as you noted, the First Lady just said that we received more than $488 million through the American Rescue Plan Act through Congress, is to stabilize child care programs now, to support providers to address staffing challenges, to help you make strategic investments in your programs, and to encourage and reward participation in the child care subsidy program. We are truly committed to equity, which means we are focusing on those programs that serve children and families who are furthest from opportunity, and providers themselves that are economically marginalized. And so you'll see as we talk about our methodology, how we're looking to particularly help those programs. I also want to note that a lot of these rules, unlike some of the previous programs, are set by the federal government. So we'll have to be sure to follow all rules and guidelines set forth by them. Let's move to the next slide, please. Many of you probably received one of our 4 rounds of CARES grants, and Virginia was one of the first states to provide direct cash assistance to child care providers across the state. This not only enabled us to get $200 million to you over these 4 rounds, but we also learned a lot along the way. We learned that funding solely based on size creates some inequities. We learned that when we heard from you, when we did listening sessions, that it's really hard when you don't know if this funding is coming, kind of comes in fits and starts. You'd like to be able to plan for a longer time horizon. And so knowing how much funding to expect and when to expect it helps you make strategic investments. We know you very much appreciated the flexibility so that you could meet your unique needs. And we know that at times, and we were building this from scratch, and huge thanks to our colleagues at the Department of Social Services who stood this up in the middle of the pandemic last year, but the application process could be burdensome and challenging, particularly for some of our family day home providers who might not have access to the same technology that centers have, and providers for whom English is their second language. And so we've tried to take those lessons learned and apply them to how we'll run the Child Care Stabilization Grant Program. Next slide, please. We moved a little too quickly. I want to talk a little bit about the grant period because, again, this is helping you plan for a longer period of time. So for the Child Care Stabilization Grant Program, and you'll note throughout the day that both Rebecca and I will talk about some of the differences. We were able to run 4 rounds of CARES fairly similarly because there weren't a lot of strings attached from the federal government. This is a little bit different because there are more strings attached, but we've tried to plan and help you plan for a longer time horizon. So officially the grant covers a 9-month period with payments starting at, by the end of November of this year. You'll be eligible to receive up to 3 payments, and then there'll be 3 kind of quarterly payments. The first one will cover September to November, the next one will cover December to February, and the final one will cover March to May of next year. We will accept applications on a rolling basis through March 2022. And you'll be able to update it as well. And it'll be one system, as Rebecca will take us through today, that you'll be able to apply and update on. If you don't have any changes, though, one of the great things about this system is you won't have to reapply after the first round. And we'll talk in a little bit more detail about how that will work today. Next slide, please. Now we're going to talk about eligibility and who is eligible to apply. So this is important because this will probably include a lot of you. And so we want to make sure everybody understands who's eligible to apply, because anybody who's eligible to apply will need to reapply no matter what has happened in the past, whether you receive 1, 2, 3, or 4 rounds of grants under CARES. So really, if you're eligible, please pay attention to how you need to apply, because everybody will need to apply. You'll hear us talk about that extensively today. So Congress set forth through the American Rescue Plan Act 2 general groups of child care programs that are eligible to apply. The first group is providers that were licensed, registered, or otherwise regulated as of March 11th of 2021, including licensed family day homes and child day centers, religious exempt child day centers, certified preschools, local government approved child day centers, voluntarily registered family day homes approved by a licensed family day system, and family day homes approved by local ordinance. So a long list there, but if you were licensed, registered, otherwise regulated as of March 11th of this year, then you're eligible. The second group is sort of regardless of what your status was on March 11th, if you are approved as a child care subsidy program vendor. So if any program that was not licensed, registered, or approved by March 11th must become an approved child care subsidy program vendor in order to receive a grant. So again, two categories. If you're both of these things, you were either licensed, registered, or otherwise regulated, and you participate in the child care subsidy program, you're golden, you're good. But otherwise, you have to fall in one of these two camps in order to be eligible for this grant program. Next slide, please. And then the sort of I think if we can go back one, please. Are temporarily closed programs eligible for funding? So programs that are temporarily closed for more than 2 weeks due to financial hardship or other reasons associated with COVID are eligible at a reduced rate. So if you are temporarily closed, you are eligible for funding. It will be a reduced rate, and Becca will talk more about that later. And if your program reopens during this grant period, then you will be eligible for the higher rate. If your program has closed permanently, your license or approval to operate has been withdrawn, then you are not eligible for grant funding. Next slide, please. Who is not eligible to receive a grant? So this is just the list of programs that are not eligible. Those child care centers that are exempt from licensure, except our religious exempt CDCs and certified preschools, programs operated by school divisions, programs operated directly by Head Start recipients. And again, we'll talk a little bit more about that because we know that there's lots of different Head Start arrangements in the state. Child care programs that became newly operational after March 11th of this year and are not or do not become an approved subsidy vendor. And then again, as I said before, child care programs that have permanently closed. Next slide, please. With that, very excited to turn it over to Rebecca Ulrich from our team, who will take you through in more detail what, if you are eligible, what you might be eligible for, how you can use those funds, and even share some screenshots on what the application portal will look like when it goes live next week.
Awesome. Thanks, Jenna. So we're going to talk a little bit about how the grant awards are calculated. And like Jenna said earlier, we worked really hard to reflect the feedback that we heard from all of you in our listening sessions following the CARES grant program, as well as the guidance that was provided to us by the federal government in order to develop this formula. Next slide, please. So there are four kind of key factors that grant awards will be based on. The first is the number of children that your program is authorized to serve, whether your program is open to serve children or temporarily closed, whether you operate on a full or part-time basis, and whether your program is located in a high-need community as defined by a CDC-developed measure. So let's talk about each one of these criteria in a bit more detail. Next slide. So when we say licensed or approved capacity, the number of children you're authorized to serve, this is the number of children that the maximum number of children that you could serve at any given time, not necessarily how many children are actually enrolled or actually attending on any given day. Per child rates are based from there on your program type. So whether you're a family day home or a center, your program size, and then whether you operate on a full or part-time basis. Next slide. And as Jenna said earlier, grant awards for part-time programs are calculated with a lower rate per child. So programs that are operating on a full-time basis are considered those that are operating for more than 780 hours in a given year. And part-time programs are operating for 780 hours or less, which is equal to approximately 15 hours or less per week if you're operating year-round. Next slide. And then in terms of operating status, providers are considered open if in general you're open and operational to serve children. If at the time that you are applying, you happen to be temporarily closed due to a COVID-19 exposure in your program, and you anticipate that period of closure will be for 14 days or less, then your program is considered open for the purposes of the grant formula. Closed programs are considered, or programs are considered closed if you've been closed and not serving children for longer than 14 days for financial or other reasons associated with the COVID-19 pandemic. And any programs that are only serving children virtually, and we don't anticipate there are too many of these, but if you happen to be only serving children virtually, you would be considered closed for the purposes of the grant award formula. And closed programs receive 1/4 of the base grant award rate for open programs. Next slide. So lastly, providers can receive a 10% increase on top of their base grant if you're located in a high-need community as defined by the CDC's Social Vulnerability Index, or SVI. SVI scores are designed to help researchers and government officials identify communities that are more likely to need higher levels of support, either before, during, or after a public health emergency or a disaster like the COVID-19 pandemic. Providers that are in a city or a county with a SVI score at or above the 50th percentile can receive the 10% increase on their grant amount. That said, we also know that there are many programs that are located in more affluent cities or counties that perhaps are not identified as being high need on this measure, but who are serving a low income or otherwise more vulnerable or marginalized community. And so we will have a process by which you can appeal in order to receive that 10% increase. And more information about that will be available on the website next week. Next slide. And then finally, we will also include a one-time bonus for providers that participate in the Child Care Subsidy Program. So if you are an open program and you're an approved child care subsidy vendor at the time that you apply, you'll get a bonus worth 20% of your base grant amount with your first grant payment. And if you become an approved child care subsidy vendor during the grant period, then you'll get the bonus in the following quarter after you were approved. The bonus is only available to programs that are open and serving children. So if you're a closed program and you're technically an approved subsidy vendor, the bonus would be applied once you reopen. Next slide. So this chart shows the kind of range of funding that you might be able to expect based on your program type, size, full or part-time status, and this assumes that you are open and operational to serve children. So if you were closed, it would be 1/4 of this amount. And you should note that these are for example purposes only, of course. Your specific grant award will really vary based on your program's individual circumstances. And we're in the process of developing a calculator that will allow you to estimate how much you might be eligible to receive based on the factors that influence your grant award. And again, that'll be available on our website within the next week or so. Next slide. All right, so like Jenna said, this this funding definitely came with some additional requirements set by the federal government because the program was established formally by Congress. And so we want to talk a little bit about those specific provisions that providers are expected to adhere to in order to receive grant funds. And these conditions are unique to the Child Care Stabilization Grant Program. They didn't necessarily apply to CARES. Next slide. All right, so these are the general conditions or statements that you'll know when you go and submit your application, you'll be asked to agree to. And we'll talk about each one of these in a bit of detail. Next slide. So as a condition of receiving grant funds, providers are expected to meet local, state, and federal public safety guidance, regulations, and laws. And so in Virginia, this might include, but isn't necessarily limited to, the DOE guidelines for child care programs, the DOLE standards for preventing COVID-19, for the public health order on masks in public and private schools, the federal CDC transportation order for masks, which can apply to some child care transportation settings, and then federal vaccine and testing mandates for large public and private employers. The specific guidance, laws, and regulations that apply to your program is going to potentially differ from that to another program. And other guidance and regulations and laws apply. For example, providers are always expected to follow our licensing regulations and code related to child care licensing and background checks. Next slide. The law also requires providers to agree to meet CDC guidelines for child care programs to the best of their ability. So what this means is that you should stay up to date on the guidelines and do your best to follow CDC recommendations in your day-to-day operations. But we acknowledge that you have to keep your program's kind of specific physical setting as well as the developmental needs of children in your care in mind when you're implementing that guidance. I also want to make sure to say that the CDC guidelines and any guidelines issued by VDOE related to COVID-19 are considered best practice, and they're not subject to enforcement by the Office of Child Care Health and Safety. So the Office of Child Care Health and Safety only monitors providers for compliance on the licensing regulations, not on this other guidance. But we do reserve the right to separately monitor any grant recipient on efforts to comply with the COVID-19 guidance as a condition of the grant. Next slide. So the federal law really wanted to acknowledge the importance of supporting child care educators and the other important staff that keep child care programs running smoothly. And so the law requires grant recipients to maintain employees' weekly pay and benefits for the duration of the grant period. So that means from the time that you apply until May 31st of 2022, you should not cut your staff hours or involuntarily furlough staff. And employees are defined in the law as any staff employed by the child care program, including educational, administrative, food service, and transportation staff. One thing that's important to note here, though, because we know we have lots of programs that are structured differently. Some are standalone childcare, and some are part of much bigger organizations or operations. So if your program is part of a larger organization that provides services other than childcare, whether you're a private school or a YMCA or a Boys and Girls Club, employees apply only to the staff that exclusively support the child care program's operations and daily activities, not to employees that are shared across different functions or that don't interact with the child care functions at all. Next slide. The federal law also recommends that grant recipients support parents who are struggling to make tuition or co-payments with grant funds. I want to very, very clearly state that this is a federal recommendation, but it is not a requirement. DOE and DSS have really been working hard to make the subsidy program available to more families, and we've committed to covering parent co-payments in the subsidy program through May of next year. And this is kind of hot off the presses. We just were able to extend that benefit. So we strongly encourage you to direct any families to your program that are struggling to make tuition payments to the child care subsidy program, as we've dramatically expanded eligibility across the state. Next slide. And then finally, providers are required to use funds only for approved purposes as identified in the law. So there are 6 kind of broad categories of approved expenditures, including costs associated with recruiting, retaining, training, and compensating staff. And that can include paid time off to get a COVID vaccine, to recover from a COVID vaccine, or receive COVID-19 testing, as well as other kind of general paid leave related to the pandemic. It can also cover payments for rent, utilities, insurance, facility maintenance, and minor improvements to your physical location. Next slide. It can cover equipment, supplies, or services to help mitigate the spread of COVID-19 or to meet state and local health and safety guidelines, including costs associated with purchasing COVID-19 testing kits or covering costs associated with COVID tests. It can cover equipment, supplies, goods, and services that will kind of facilitate social distancing or outdoor play, improve your business practices, or just support your general regular operations. And it can cover mental health supports for staff and for children. Next slide. So you'll note that these categories are really pretty broad, and in general, most of the investments that you might like to make can be supported with grant funds. The one exception to that is capital investments. So you are not permitted to use the funds for major construction or renovation projects, like building a new location or adding on to an existing one. It's important to keep in mind that funds can be used for previously incurred expenses. So in other words, you can use grant funds to offset allowable purchases that you've already made, like payroll or rent or mortgage payments, in order to free up some of your operating expenses or your operating revenue from private tuition or subsidy payments for other purposes. And then you should also note that there is no deadline to spend the funds. But again, we really do encourage you to use the funding for immediate needs so that you can free up revenue that you're receiving from other sources to use however you please. Next slide. A few additional expectations that are important to note. So DOE does have the authority to monitor providers for compliance with the grant requirements and will do so. So you should maintain receipts, your expense reports, payroll, and any other documentation to show that you met the grant requirements for at least 5 years or until May of 2027. If you close permanently for any reason during the grant period, you are required to notify us before you close. And that will allow the DOE grants team to help to determine next steps. And then finally, we retain the right to discontinue funding if a provider is found to be in violation of any applicable law or regulation, such as in instances of substantiated cases of abuse and neglect, or if your license, registration, or certificate is withdrawn for noncompliance with the regulations or the law. Next slide. All right, so now we'll get to the good stuff. We're going to take a look at the application portal. So the portal is expected to launch on Monday, and I only have screenshots available at this time, but it should give you a good sense of how the application works, what it looks like, and what you can expect when you are logging in for real. Next slide. All right, so a couple of important things for you to know before you apply. The first is that everyone will need an email address in order to submit an application. And we will not accept paper applications. So if you don't have an email address available to you, make sure you sign up for one now. The application is available in multiple languages, So once you're in the portal and navigating the grant portal, you can select a language, and then all communications from the grant system will come to you in your preferred language. So you'll get some automated emails kind of letting you know how your grant is progressing through the review process and when you can expect to receive payment once you're approved. And so if you select, for example, to fill out your application in Spanish, all of those automated emails will come to you in Spanish as well. And then the other important thing to know is that all of the required information is entered into the application itself. So you don't have to upload any documents in order to apply. Next slide. But you will want to have something handy in order to complete the application. So you'll see that some information about your facility is already pre-populated from the licensing system, the database for the locality, if you're approved by local ordinance, or from infant toddler family daycare if you're a system approved home. So you can look at that information, review it to make sure that it's accurate. But if it looks good to go, you don't have to touch it. And you only need to edit it if anything is incorrect. And it should take no more than 15 or 20 minutes to complete the remainder of the application. It should be a pretty quick and simple process. Just make sure that you have the information that's listed here ready to go. Another kind of reminder about what you'll need to complete the application is available in the portal before you actually get started if you need another reminder once you're in the system. All right, next slide. So you'll start by registering for an account with your email address. And as a reminder, you do have to have an email address to submit an application. So this is next slide, please. So once you log in, so you register your account, you get set up, this is the landing page that you'll see when you log in. So when I said that you could translate or have the application portal translated, you would do so by clicking on the globe in that top right-hand corner to select another language. And like I said, once you choose another language, the whole portal will translate, and then all of the communications will come to you in that language as well. The landing page also includes the phone number for the help desk and the grants team email address down over on the right-hand side. So if you're having trouble filling out the application, or if you need some assistance with an IT-related issue, like you need to reset your password or something, you can reach out by phone or by email. But if you have an IT need immediately, definitely recommend reaching out by phone. So when you're ready to submit your application, you will click on that provider portal button. Next slide. And then once you're in the portal, the first thing that you'll do is connect the user account that you created with your email to the facility record that's already located in the grant system. So you'll look up your program by finding your facility type in that drop-down menu and then inputting your facility ID. So your facility ID is a code that's assigned to you by VDOE or the locality in which you are registered. So if you're licensed or regulated by VDOE, by the Office of Child Care Health and Safety, you can find your facility ID using the Child Care Search tool or the Search for Child Daycare tool. And we'll have links to that tool so that you can find that information easily on our website. Family day homes that are approved by local ordinance or the Family Day system can contact us if they need help finding this information, but your local contact should have it as well. I also want to mention that we're preparing
Becca, I think we lost you.
Yeah, I was about to check Kathy.
Mhm. While she tries to get hooked back on, Jenna, do you want to kind of take up for her?
Absolutely. She just lost audio. So yeah, so
Again, this is, the key part to look at here, right, is what's covered in the box on this lower right-hand column, making sure that you find your facility ID. If you need to, you can look it up using the online child care search tool, but by having your type and facility ID, it will enable us to fill your system with all of your information so you don't have to retype and be redundant. Next slide, please. Up, you'll see here, this is an example, right? And you can sort of, then when you type those things in, you'll look at the lower right and you can hit select, right? If you don't see yours pop up in the search function, it means you might be off. So again, double check your facility ID, double check your type. You can always contact us, and you see our email address here. For some reason, you try a few times if you can't find it, but then once you find it, click select. Next slide, please. And then you will find out more information. You'll see here on the left-hand column, like mini applications. It's all of the steps that will take you through. This provides an overview. At the bottom of each page, you'll see our number for our hotline as well as our email account address, excuse me, if there's any questions or concerns. Next slide, please. These next few slides will then take you through that order. So again, if we know about you, right, because we should have all of this information and can pre-populate it, what we're asking you here is to go through and make sure that everything looks accurate. And kind of checking through each of the different sections. Do we have the right number? Is it the right person? And so on. Next slide, please. So then these are the questions where we will not have the information, right? And so please making sure that you go through, read carefully. Are you open in serving people in person? Are you open in serving children virtually? Are you open but not serving, sort of due to temporary kind of quarantining that's not considered closure, it's less than 14 days, or you close due to financial hardship due to the public health emergency. Part-time or full-time, and then clarifying kind of early Head Start or Head Start. Again, we know there are lots of complicated Head Start arrangements, so don't hesitate to reach out to us if there's questions or concern there, and then what city or county is your facility located. Next slide, please. This is important information for tax purposes, and so I think Becca talked about earlier that this is taxable. So really, again, going through, filling out everything that is required. That red asterisk means it's required. And to click all of these, make sure we get this information so that we can get you what you need for tax purposes at the end of the year. Next slide, please. Then this is an important one, choosing your method of payment. So for the first round, we'll only be able to do paper checks, but for the second and third round, if you are interested in direct deposit or electronic fund transfer, let us know here, and then it'll be very important that we get the email address for the bank account holder where the funds should be deposited. Note that it won't come from the Department of Education. It will be bill.com for direct deposit, and so you'll have an additional set of information if you select that you'll need to complete. Next slide, please. Then we have some demographic information. The federal government is really seeking across the country to understand who is benefiting from these programs and where there might be gaps. This is optional, but we strongly encourage you to check all of these that you feel comfortable with so we can have an understanding of how well we're able to get out to all of our diverse communities across the Commonwealth. So again, race, ethnicity, primary language spoken, gender, optional questions, but we strongly encourage you to complete them. They will not affect your application one way or the other, though, I should note. Next slide, please. Oh, back one. This is how you plan to use your grant funds. Again, this is required because we need to understand how you think you're going to be using. This is not a binding response. So again, let us know based on what you know at that point in time, what you think you might want to, you're planning to spend it on. It is completely okay if you have a different purpose later and you need to spend it on something differently, as long as it's still an approved purpose. So again, for informational purposes only. Next slide, please. And then this will give, based on the information that we have in the system, based on the information that you have provided to us, our best estimate on what you will be eligible for in terms of your award calculation. And so again, this would be filled out based on this. This is what is shown on today is an example. This is not how much folks will receive, but it will pop up if you fully completed your application. Next slide, please. Then it is certification and electronic signature. As Becca noted, you don't have to upload anything. You don't have to submit any documents. You will basically read through, please, right? Like everything that you sign your name to, please read through these 8 assurances carefully. Becca's already talked to them, so I won't repeat them here. And then we'll take an electronic signature where you type in your name, you in the date, and then you'll see by clicking this box, you're agreeing to all of the assurances. So again, a much simpler application process. But please make sure to slow down and read all 8 of these assurances because it's really important that we're following all the rules and regulations. Next slide, please. And then last but not least, you'll be able to review your application. You'll see we've circled right here. If something's off, just click edit. So don't try to do back on your browser. It's better just to click that edit in that top right-hand column. Double check, look over, make sure all of your information is accurate. And then you'll be able to go to the next slide. You'll click submit, and then you will receive an automatic notification. Thank you for applying. You'll see your application number is right there, which is good to have. We still have our email address if there's any questions or concerns, and then you can click I'm done. I don't know if this happens to you sometimes. Sometimes I'll realize right after I hit submit that something was off, and I'm nervous and I'm worried and concerned. Please don't hesitate to reach out to us if there's something that comes out and you said, oh, I forgot about this, or I realized this afterwards. Do not hesitate. We have a whole outreach team that is here to support you. So if anything, any questions or concerns after the application is submitted, that's fine. Just let us know and we can help you. And then the next slide, please. And then one of the great things about this portal and why we require the email address and the logging in is that you can actually check your grant status. And so I know this is something that folks said in prior rounds it was tough because we didn't have a way to understand where our application was, what status it is. So you'll be able to see your name, your kind of eligibility. You'll see if you'll see circled here. This is if you need review or where it is. And then you'll be able to download your application if you want a copy of your application that you've completed, and if you need to edit your W-9. So again, it's a more dynamic system that if you realize you need to, you want a copy of your application, you want to use it. We know in other places you might want to use it to show folks that you applied. You'll be able to do that and check your status through the portal. Excellent. Next slide. All right. So with that, Kathy, I know that wraps up our description of the grant program, who's eligible, kind of ballpark what you're eligible for, but as you see, you need to go into the portal to determine what your estimate and amount is, and the actual portal that you will fill out that is planning to go live on Monday. We have tried to make it easier. Everybody must reapply. Please help us spread the word broadly, but it should pre-populate with information, so it should be a streamlined application process. What I propose, Kathy, is I take a couple of moments just to address these slides related to the staffing crisis and then to potentially go to questions. How does that sound to you?
That sounds fine. We do have a good number of questions coming in about the application, but if you want to go ahead and address this, then we can take them all at the end.
Perfect. And I think Becca's saying the session is full. I don't know if there's a way to allow her in as a panelist or if that affects that. So we are, and as the First Lady noted, very pleased to be able to get these dollars out to you. I know we have been talking with you all about these since the spring, and one of the things that we hear from you loud and clear is that the staffing crisis has really worsened over the course of the spring and summer, and folks kind of across the state feel like they're at breaking point.
the first and most important thing for us has been being able to get this program ready, to check all the boxes, get the approval from the General Assembly, get the technology set up so that we can get these dollars in your hands and provide you the most flexibility with these dollars to be able to support staff. But I'd like to take just a few minutes to also talk about some of the other things that we are thinking about as it relates to supporting you to address the staffing crisis. Next slide, please. These are just headlines, which I know you all have seen. You've kind of across the country, regardless of political affiliation or where you're located or what's going on, everybody's talking about how difficult it is to hire. There aren't enough applicants. Candidates don't show up for interviews. People will say they take the job and then they'll show up, or they might stay for a week. Many of you are leaders who are driving your buses, working in the kitchen, back up on the classrooms, or even serving as lead teachers. And we know that this is causing such strain on you all, on your educators, and on your families. And generally, the childcare industry has high turnover, but this is, to use an overused word throughout this pandemic, unprecedented. Next slide, please. We know that, and we are hearing from you. I just heard somebody that sort of said that, that 4 out of 5 of you are saying that you're understaffed. As we're hearing as well in the Virginia context, I heard this morning. And we also know that 4 out of 5 of you are saying that low wages are making it really difficult to recruit, to attract, and to retain educators. And so we're really encouraging. We know there are a lot of ways in which these funds can be used, but encouraging folks to think about how to put these American Rescue Plan Child Care Stabilization grants towards compensation, incentives, bonuses, higher pay, whatever it takes to better support our workforce. Next slide, please. We also know that compensation is not the only thing. It's one of the most important things, but not the only thing. And so in addition to the Child Care Stabilization Grant, we know that we're sort of thinking about other sources to address compensation and to be able to ultimately increase subsidy rates, right? So we can sustain some of these investments in your programs. We hear from you that there are hiring barriers and looking at where we can address those. We're thinking through about keeping our littlest learners healthy and safe, where we can offer flexibility on health and safety. I'm going to talk in a moment about some new flexibility that was provided to us by the General Assembly around some temporary increases in ratios. And then last but certainly not least, we have heard loud and clear the First Lady, myself, Kathy, others, about what we need to do as a society to elevate and increase public awareness of our early childhood educator profession. You all have been on the front lines and have stepped up in an extraordinary way, and now is the time to truly recognize this profession. Next slide, please. This is a status update on some of the areas in which we are taking action to support you. Obviously, a big one is what we spent the last hour, which is these child care stabilization grants that will provide more than $400 million to the field, which is twice what we provided across the first 4 rounds of CARES, just for point of reference. We also are providing, for those of you that are participating in our early childhood educator program through our preschool development grant community network, we are now up to 6,000 educators signed up this year to receive up to $2,000 per educator, helping us get the word out and helping to attract and retain staff. And as I noted before, we are working to recalculate subsidy rates. We know that it's based on a market that is totally flawed. And so trying to do some analysis to be able to base it on the cost of quality, get that approved by the feds, and hopefully the goal is to increase rates in 2022. So some discrete actions there. We're working on background check portability very closely with DSS because we know that is a huge barrier, and really sort of trying to think through how we could allow for provisional employment, because oftentimes by the time you get the background checks done, she's already left and taken another position at Target, at Walmart. And so really kind of looking through how we get that portability and then how we sort of address additional flexibility there. We know on health and safety flexibility that we heard from you some of the concerns around the new regulations coming in effect in October. We normally do about 60 days of an implementation period. We extended that to 90 days because we know we have so much going on. And we also have a process underway with the Early Childhood Advisory Council to streamline the regulations and really take a look at how do we balance between keeping our littlest learners healthy and safe, but also reducing some of the regulatory burden for you if it's not absolutely necessary to keeping kids healthy and safe. I'll talk in a second about our new ratio flexibility, but we've been working very closely with our attorneys and hope to have guidance out to you this month about some flexibility there. And then as it relates to our educator profession awareness, just wanted to make sure everybody was aware of our Child Care Aware Virginia Job Board. And we've started some efforts working with the Child Care Association and others on how we could create a statewide campaign to raise the profile of our educators and attract more educators to the field. I want to do a little plug. We are in partnership with the University of Virginia doing a survey of providers. So if you get a link to do a survey, it will help us better support sites, help us improve access to childcare. It's all providers, whether or not you take childcare subsidy or not, and you will receive a gift card for your time. So be lookout for a survey link from the University of Virginia. That should also come in early November. So really wanting to hear from you and to use that information to better address the pain points and the challenges that you're facing in the field. Next slide, please. So with that, this is just a sneak preview, and that I want to make sure to hold some time for questions. But our General Assembly in our summer session, the end of the summer, provided the state superintendent with some unique specific flexibility to temporarily increase ratios. So this is the exact language from the Appropriations Act, so that's the budget bill, that basically allows the superintendent to provide a waiver. We are working right now with our attorneys on the details, so how you could request this flexibility. You will have to notify families in writing, but you'll be able to increase the number of children per staff by 1 for groups of children from birth up to the age to attend school, so 5, and then 2 for groups of children from the age of eligibility to attend public school. So we will get you more guidance on this month. The key sort of caveats to note are, one, that you have to notify families in writing, and 2, don't make these changes yet. We have to get you more information guidance, which should come this month from the Office of Child Care Health and Safety, which is led by Jeff Williams. So again, we know this won't work for everyone. We know that some of you, if you take Head Start funding or if you're subject to other program guidelines or local ordinances, this might not work. But again, the challenge of these crises, we're just trying to flexibly explore any potential solution. And so this might give you a little bit of breathing room on ratios as you go forward. Next slide, please. And one last plug before I ask Kathy to begin sending questions our way. Wanted to let everybody know our partners at Child Care Aware of Virginia have worked since the beginning of this year to get a child care and early childhood education job hub. It has exploded. There have been thousands and thousands of views, I think over 100,000 views, I think more than 6,000 applications and postings. So really encourage you. It's a long website. Take a look at the bottom of the page there. You can also just Google this and it pops right up. But if you are looking to hire, it's a great platform. It allows you to automatically share to a couple of these websites, Google, LinkedIn, Indeed, and allows you to manage the process. And so we know there are tough times. This is just one resource. Wanted to make sure everybody's aware. It's a free now. It's a trial subscription. I think you can be a part of the shared services network ultimately to continue to do it, but encourage you to at least check it out while it's free and available to you if you are in the hiring process right now. Well, with that, and I think Becca's joined, so I'm going to mask up, and then Kathy, take questions.
All right. We do have a good number of questions. I think I'm going to bounce back to questions about the applications and get started that way. We have a number of questions from folks about the slide where you showed the expected funding amounts for different sized programs. And they wanted to know if those amounts were total or the amount that would be received each quarter.
That's a great question. Those are total amounts. So the
the actual amount that you receive each quarter would be a third of that amount if you apply by November 30th, which is the first deadline, or the deadline to apply in the first quarter. So you're only guaranteed to receive all 3 payments if you submit an application by November 30th. From there are then, there's a second quarter application deadline and then a third quarter application deadline. If you apply in the second quarter, you get 2 quarters worth of payments. If you apply in the third quarter, you get 1 quarter's worth of payments.
Got it. Thank you. And several folks have asked, is this just for early childhood, birth to 5, or is it for school-age childcare facilities as well?
That's a great question too. This is open to all licensed, regulated, registered childcare programs in the state, regardless of the age of children that you serve.
All righty. And folks are wondering about where they could find information about their SVI for their center.
That's another great question. So we are in the process of finalizing a suite of informational materials that will all be posted to our website by Monday morning. So included there is a super in-depth FAQ that'll answer just about every question you might have, though I'm sure that folks will think of others, and we'll continue to update that resource as questions can arise. But included in that FAQ document is an appendix with a list of all of the cities and counties in Virginia and an indicator of whether they are considered high or low on the SVI scale.
Great. Then some folks are wondering about if they have multiple sites. So for example, like a Boys and Girls Club that have multiple centers under their organization, or just organizations that have more than one site. What would you suggest to them about applications?
Yeah, so if you are a program that operates multiple locations or multiple sites, your award is issued based on the kind of individual licensed or regulated location. So for example, if you have a regional YMCA that operates, 5 after-school programs in a given city or county, you would submit 5 individual applications for each location. But when you log into the application portal and you link your user account to the facility record in the system, you can do that for all of your sites. So you don't have to create like a different account for every site. You can manage the applications and the award information for every single location that you would submit an application for, all in one kind of, all in your account, your portal.
Thank you. Next, folks are wondering, is the funding guaranteed, or do we need to wait for any kind of legislation or approval to be passed?
Yeah, so this was, and part of why it's taken us a few months to get this up and operational is it did have to be appropriated by our General Assembly, but the full amount was appropriated to the Department of Education in the August General Assembly session, so we should be good there.
Terrific, thank you. Let's see, a lot of folks are asking for the URL for the email address or this website address where the portal will be found. Is that something that you can provide now, or will that be provided later?
It'll be provided later. It's not live yet, so it won't take you anywhere. But we will be sure to send a notice to our licensing listserv on Monday when the portal goes live.
Okay. Lots of folks are going to be very anxious for that. Some have asked if they could receive applications in the mail.
Unfortunately not. So we are only accepting applications online for this program. So you do need to create an email address, and you do need to fill out the application online in the system. If you'd like a copy of the application questions, we'd be happy to share that, and that you can print out and you can have handy so that you know exactly what is included. We'll also be, one of the other resources we'll be posting is a set of kind of screenshots of the application with just
tips and information about where to find different pieces of information or some of the kind of additional guidance that was shared in the webinar today. So that can also be a useful resource if you kind of you want to be able to look at what the application is asking for before you actually kind of go in and start filling it out. But we are only accepting applications online for this program. Becca, do you also want to talk about the help desk? Oh, yes. So if you need assistance completing your application or you're not sure how to navigate the portal, you are always welcome to contact the help desk number, which is it's a 800 number that's included on, when you log in, you'll be able to find it right away on the portal. Or you can email us at childcaregrants@doe.virginia.gov. And either the help desk or a member of the grants team would be happy to help you complete your application.
All right. And I think this is just, a signal of how important these grants are to providers. Folks are wondering if this is first come, first serve. Is there a rush to get the application in?
So yes and no. So no, they're not first come, first serve. We have designed this program to be available to every licensed, regulated, registered entity in Virginia that wants to receive grant funding. However, you're only guaranteed to receive all 3 payments if you apply by November 30th. So it is really critical that you apply by that deadline to get your full grant award.
And would you just review again that you need to apply just once, but give the ground rules for that?
Yes. So when you submit your application, so you go online, you submit your first quarter application by November 30th. And once you have submitted your application, you don't have to reapply to get those next quarter grant awards. Those will be issued to you automatically. And if you experience any changes in your contact information, the location of your facility, for example, if you're a family day home and you move, any of that information should be reported to the child care licensing team, or we can accept those changes and we'll pass them on to our licensing team. But we'll update all of that information on a quarterly basis so that any changes you've experienced in your license capacity, your location, your participation in the subsidy program are reflected in your next quarter's grant award. If for some reason we do need to reach out to you, if something looks off or we need to give you a call, you'll be able to see that your application went into review, and you'll get an email saying that we're taking another look and we'll reach out to you if we have questions. The only thing that if something changes that you would proactively go into the system to change is if your tax information changes. So if you need to make an update to your W-9 form, you can go into the system, you can hit edit W-9, and you can go ahead and provide the changes to that information, and then we'll update your payments accordingly.
So if nothing changes, your license capacity doesn't change, your subsidy vendor participation doesn't change, all you have to do is apply once by November 30th, you'll receive all 3 rounds. But if something changes, then you need to work with us.
All righty. Do I understand correctly that there's no deadline to spend the funds and no follow-up report to document how monies were spent?
That's right. So we are asking you to retain your records. So you should maintain receipts, you should maintain any expense reports, invoices, payroll, whatever documentation is appropriate to demonstrate that you have spent the funds on an approved purpose. And then you should maintain documentation to demonstrate that you met the other requirements of the grant as well, right? That you didn't lay off or reduce hours for any of your staff, that you had some guidelines in place to help mitigate the spread of COVID-19. you should retain those records for at least 5 years after the end of the grant period. So that's May of 2027. But there is no mandatory report that you would provide back to us to tell us how you spent the grant funds, and no deadline to spend them.
We do encourage folks to think, Kathy, about spending sooner rather than later, particularly on operational costs. These probably should not be your rainy day fund dollars, but instead think about putting them towards allowable expenses like payroll or rent now, and using some of your other revenues, as Becca noted, like your subsidy payments or your private revenues, and putting those into your rainy day fund is one of the suggestions that we're making.
Sounds good. Would you all review information about whether these funds, some questions have been, are these loans that need to be repaid? Is this considered taxable income? If you can help providers understand how to consider these dollars.
Yeah, sure thing. So these are considered grant funds. They are not loans, so you absolutely do not have to pay the funds back unless you violate a term or an agreement, right? We reserve the right to recoup the funds if you were in violation of the grant terms or conditions, but it's not a loan, so there's no expectation that you use the funds and pay us back later. And then this is taxable income, however. The government didn't exempt, Congress didn't exempt these funds from taxation, and so they'd be taxed the same way that if you participate in the child care subsidy program, that your child care subsidy program revenues are taxed. So you'll receive, if you're eligible to receive a 1099, you'll receive a 1099 in the mail for these funds to reflect the payments that were made to you.
All righty. And then some folks are wondering about once their application has been approved, when would they receive the funds?
Yeah, so it depends a little bit on the which method of payment you request. So we're estimating 2 to 3 weeks from the time your application was approved for direct deposit, 4 to 6 weeks from the time your application was approved for paper checks. I want to make sure to say that all of the first round payments will be issued via paper check because there are some extra steps that you have to take to enroll in direct deposit, and we just want to make sure that we can get the funds out the door as soon as possible, and there's no processing delay on our end to get the funds to you. They could come sooner than that, but of course it's all subject to the volume of applications we receive, and then just external conditions like the speed of the USPS, which unfortunately we can't control. But you will get that email telling you that your application has been approved for payment. So you should generally be able to judge, if you haven't heard anything or you haven't received anything in the mail within 6 weeks, you can reach out to us and let us know.
All right. And then we have some questions from family day home providers who are wondering in particular about ways that these grants apply to them. Some are wondering if they are, have no employees, if it's an individual who owns and runs the program, can the funds cover their salaries, compensation?
Absolutely, 100%.
All right. And
Kathy, we will give them permission here to give themselves a hardship bonus as well. In fact, I would encourage that.
Let's see. What if you're closed temporarily, but then that ends up being permanent? What do you advise folks to do? And I assume that means if they apply and are approved for a grant and then their temporary close ends up being permanent.
Yeah, so in those circumstances, like I said, we would just ask you to reach out to us prior to the kind of date that your permanent closure is effective. And that will allow us to work with you to identify any next steps. It'll also make sure that we can cancel any future payments so we don't have to try to recoup anything. And then we can kind of work with you to identify a plan for the funds that you have received so far.
All right, and then several other questions about quarantine. And so if they have sort of multiple sequential quarantines, or if they have to close multiple times for a total of over a 2-week period, they're wondering what to do then.
Yeah, so the intention again is in kind of trying to make that distinction is really to capture those sort of one-off closures that are outside of the any individual program's control. And so again, if at the time of application you happen to be closed by not by your choice, but by under the advisement of public health guidance, due to an exposure or outbreak at your facility, you would be considered open. And again, the idea is just to capture that current closure should generally be anticipated to be for 14 days or less. If something else happens and you end up having a longer period of closure, that wouldn't necessarily affect your grant award. Because again, that is a closure by no choice of your own, and it is necessary to keep you, your staff, the children in your care, and their families healthy and safe. And the same goes for, even if they're not in succession, multiple closures during the grant period, that does not affect your grant eligibility. We know you can't help that, and you all have been absolute champions trying to navigate that incredibly challenging process. So we totally understand that and have no intentions of that affecting your grant award or eligibility.
Thank you. A number of questions related to the process of becoming subsidy vendors. Some folks are in process and not sure how long that process will take. Any advice that you would give about the, at times lengthy process for becoming subsidy vendors?
Yeah, and that's a great question. And I'll just say up front that we're working really closely with the Child Care Subsidy team at the Department of Social Services that handles all of the vendor applications and processes, as well as the Office of Child Care Health and Safety at the DOE, which does the Child Care Subsidy inspections. And we're all in close communication and really keeping an eye on the potential increase in applications for the subsidy program so that we can be responsive to any changes. In general, the application process to become a subsidy vendor can take anywhere from 30 to 60 days, assuming that you have submitted all of the required paperwork and are responsive to completing the vendor agreement and taking any additional steps to answer questions by the subsidy vendor relations team during that time. It can take longer than that if there's, if the team needs to go back and forth with you on your documents, or if a piece of your application is missing, or things along those lines. But we're generally recommending that you kind of plan for a 30 to 60-day window to navigate that process. So if you're interested in becoming a subsidy vendor, we definitely encourage you to apply sooner rather than later, so that we can work with you to get you enrolled well before the March 1 deadline.
I think similar, Kathy, to what was asked earlier, there's not a cap here. So, again, you don't have to rush out and do this tomorrow. I think it's important that folks get their documents lined up. I think, folks have been, there's a lot we've heard from vendor relations that goes much more smoothly when you've got everything ready. We will be tracking numbers by week, and I think we also, if there are particular challenges that you're facing, please don't hesitate to reach out. As Becca noted, we're working very closely with both our Office of Child Care Health and Safety as well as vendor relations over at DSS, and we want to bring on to the subsidy program everybody who wants to do it, right? In the same way that we have budgeted this program to serve every eligible provider in the Commonwealth. So this isn't sort of first come, first serve. This isn't a limited amount. We would love if every single one of you would be willing to take subsidy kids and be a part of this really important program, as together we look to increase access for kids across the Commonwealth. So really encourage you to think about it, take a look at the documentation. We can probably work with Kathy at some point to also do a statewide webinar on the process, so that's helpful. If there's other things that we can do to make that work better for you. That survey that's going out is helping us think through how we can strengthen the child care subsidy program. So please, we really encourage you to please consider this and let us know where the challenges are, and we can work with you to address those.
Thank you. A very practical question. Folks are wondering about the facility ID. Is that the number on their license? And is there another way they can identify their facility ID?
It's the number on their license before the hyphen. So on your license, you probably have a number, hyphen, and then like an L and some more numbers. So it's the number before that. But again, if you're licensed or regulated, you should be able to go to the child care search tool. So if you search, go to the search for a child daycare site on, it's currently still sitting on the DSF public site, but is linked to our licensing data. If you go there and type in your facility name, the facility ID will pop right up.
Awesome, thank you. Now I see a number of questions with, specific things like, would this be covered if they purchased an AC unit, if they purchase a van for transportation? There are a number of questions about sort of allowable expenses. I see you all nodding, but I think also if you could help folks understand, the range of information, FAQs, et cetera. Would you just repeat that again about what types of information they're going to have access?
Absolutely. So we're planning to publish a series of resources. So we'll have an in-depth FAQ. We will have an application kind of walkthrough document. We're recording in the next couple of weeks a tutorial that will walk you through the steps of completing the application. We're working on developing a grant calculator that you can kind of go in and input information to find out what you might expect to receive. You could calculate, if I become a subsidy vendor, how much would my bonus be worth? Things along those lines. And I think, we have some general guidelines around the allowable expenses. Kathy, I'd love to see some of the specific questions that are coming through after the webinar so that we can kind of incorporate those specific details into our guidance. And we'll likely be looking to develop a kind of more specialized resource on allowable expenses, since there are probably things that aren't occurring to me right now that are top of mind for you, and we just want to make sure that we're kind of incorporating the range of allowable expenses, and helping folks navigate that. Kathy, I'd also, of course, make a plug for, we're working with the ECS to offer technical assistance to help providers identify, best uses, strategic uses for their funding. And so Kathy is working hard to pull those resources together, and we're working closely together to kind of identify next steps there and how we roll that out. All of that information, once it becomes available, will be available on the grants website.
Thank you. And I agree, Becca, the questions today are really helpful to us in terms of informing what kinds of technical assistance and resources will be needed. And I just want to say also lots of thank yous and congratulations and appreciation coming through in the questions boxes. I can tell this is very important to providers, and just want them to know how hard the folks at the Department of Education have worked to make this application process easy and simple and burden-free for providers as possible, thinking a lot about providing the information in a number of languages, having plenty of staff on hand to answer questions and to guide folks. So please know, all of you who are working so hard every day to provide care for our children, you are appreciated, and this is hopefully going to be a really terrific way for you to continue to be supported in your important work. I think that probably about rounds it up for the day. Jenna and Becca, thank you so much for being grilled and answering questions so quickly in and efficiently. And just for those who are on the call, the recording of this will be sent by email. The same way you registered, you will receive the recording afterwards. And just for those who are Spanish speakers, or please spread the word, there is a similar recording tomorrow at noon for a Spanish speaking audience. So once again, thank you, Becca, Jenna. We're grateful to the First Lady for popping in from her travels, and appreciate everybody who's given us time today to provide such great feedback and ask these fabulous questions. Thanks to everybody, and have a great afternoon.
On the store.